Hello, this is Dr. Richard Downs with Sleep Balance Academy and Nefense.com. I'd like to talk to you about mouth taping. You've probably seen the videos. People are taping their mouths shut at night to force nasal breathing. They claim better sleep, less snoring, improved oxygen, even better facial development in children. So the question is it safe? Does it really work? Let's break it down. First, there are benefits to nasal breathing. The nose filters the air, humidifies the air, and regulates the temperature. It supports nitric oxide production, which improves oxygen delivery and vascular tone. Nasal breathing also reduces dry mouth, gum disease, and cavities, with also reducing bad breath. So the theory behind mouth taping is simple. If you tape the mouth closed, you force the body to breathe through the nose. But here's the problem. If someone has untreated sleep apnea, nasal obstruction, polyps, or a deviated septum, or even chronic congestion, taping the mouth shut can actually make things worse. You're forcing the nasal breathing when the nasal airway may not be adequate to do so. If someone with undiagnosed obstructive sleep apnea does this, it could increase oxygen deprivation. That's not a small issue, it's serious. There are other concerns too. Some people experience anxiety or panic when their mouth is taped shut. Others develop skin irritation or adhesive reactions. In rare cases, poorly applied tape can even become a choking hazard. And here's something important about mouth breathing. It's usually a symptom, it's not the root cause. Enlarged tonsils, nasal valve collapse, allergies, chronic inflammation, those issues need to be addressed directly. Taping the mouth does not fix those problems. Now, if someone wants to experiment with mouth taping, here are the precautions. You must use medical grade hypoallergenic paper tape. I do not recommend surgical tape because I've seen skin reactions in medical settings with IVs and endotracheal tubes. Paper tape is safer. Place it vertically in the center of your lips, not fully sealing the mouth. Always perform what I call the straw sip test. Make sure you can properly open your mouth easily in an emergency. I want to be clear. I do not routinely recommend mouth taping, especially if sleep apnea has not been ruled out. There are safer alternatives. One of my favorites is an external nasal dilator, especially the magnetic dilators like Intake. These gently open the nasal passages without blocking the mouth. They are non-invasive, comfortable, and they're reversible. For people with mild positional sleep apnea, nasal dilators can improve airflow flow and reduce airway resistance. They are not a replacement for CPAP oral sleep appliances in those severe cases, but they can be part of a broader plan and sometimes used with those devices. I also recommend positional sleeping. You can elevate the head about 30 degrees. That can reduce nasal resistance. Sleeping on your side, especially with the obstructed side of your nose upward, can improve nasal airflow. Be cautious with right side sleeping if you have asthma or acid reflux, as it may increase vagal tone and worsen the symptoms. Stomach sleeping can sometimes reduce chest pressure for shortness of breath. The bottom line is this: mouth taping is not inherently evil, but it's not universally safe. If you have sleep apnea, nasal obstruction, cardiac conditions, pregnancy, or breathing disorders, you should not experiment without consulting your medical doctor. And that brings us to something important. If you're snoring, tired, waking up unrested, or your partner says you stop breathing at night, the real solution is not taping, it's testing. This also applies to children who might have been diagnosed with ADHD or hyperactive or doing poorly in school. You must test. A proper sleep test can determine whether you have obstructive sleep apnea. Our home sleep studies are read by board certified sleep specialists. Many online options are not. If you want a good online option, go to our website at onlinehomesleepstudy.com. Testing first, then treating the root cause. That's the ticket. That's the right order. Nasal breathing is beneficial, but forcing it without understanding your airway can be dangerous. Be smart, test, then treat. Thank you very much.